We remain very confident that the risk of the novel coronavirus for Canadians, and including the people in the Cornwall community, remains low at this time. Throughout the process of bringing home Canadians from the Diamond Princess cruise ship, we've taken appropriate actions to ensure a limit of spread of infection and in order to keep the community and Canadians safe and healthy. This included not allowing passengers who showed symptoms or who had tested positive to join the flight today. And those who did show symptoms, as you know, are in the capable hands of the Japanese health system. Those who showed no symptoms were then transported by bus this morning to join us at the NAV Center here in Cornwall. In particular, we had 129 repatriated Canadians join us, along with 22 staff that had been traveling with them. And today they started their 14 days in quarantine out of abundance of caution for ensuring that we maintain the health and well-being of Canadians. As we did in Trenton, anyone with health concerns or with symptoms will undergo assessment by medical staff on site and may undergo testing for the COVID-19 virus. These fellow Canadians, as you can imagine, have been through a very, very stressful and arduous experience. We're doing what we can to ensure that not only their physical health is taken care of, but their mental health and well-being is taken care of as well. That includes providing social support and mental health services on site. Folks are able to move about the area of the quarantine zone that has been cordoned off. So if you're looking at it from the outside, you're going to see two fences that are 2 meters apart from one another. And again, this is really an abundance of caution to ensure that if there are people that are outside the quarantine zone who will be near those fences, that there really is no contact at all with those that are inside. Folks within the zone are able to go out and get fresh air. Most of their time will be spent in the room. However, if somebody develops symptoms or we're concerned about them as a risk, we will be asking them to stay within their room. They will have some time outside, but their time will be spent in the room, so there will be some further restrictions on that. So each individual is treated on their own, and if somebody happens to test positive, they first need to get well if they are symptomatic and are ill, and then they need to have a series of 2 negative tests in order to be considered ready to be out of that area. Because they are treated as individuals, if there are people who test positive and they are staying in a room with a family member or whatever the case may be, we may choose to test those individuals more frequently. So it's done on an individual basis, but it does not set the clock for everybody back to the original 14 days.